Thank you, Madam Speaker. 174 new cases of COVID today in New Brunswick. The second highest number of cases we've seen since the beginning of the pandemic, Madam Speaker. 94 of those are in Fredericton, Madam Speaker. 94 are here. What's going on? You shouldn't have to be a member of the COVID Cabinet Committee to find out what is going on. New Brunswickers want to know what's going on. Frederictonians want to know what's going on, Madam Speaker. This is the kind of thing that we need to be getting at. You look at the case rates for the last 7 days. New Brunswick has the highest rate of cases, new cases among all provinces except for Manitoba. And the same goes for deaths, Madam Speaker. We have the highest rate of death among the provinces except for Manitoba. How did we get here? How did we get here? 2/3 of the people who have died in this pandemic over the last 20 months have died in the last 3 months. What is going on? How did we get here, Madam Speaker? That is part of what we need to be looking at. The Moncton Hospital just announced an outbreak in its COVID unit, Madam Speaker. In its COVID unit, three staff are tested positive. This is going to take critical healthcare workers out of the system. For the people who are most knowledgeable about how to care for those with COVID are going to have to go out of the system. It's extraordinary. So what's been happening at the Moncton Hospital? Why has the virus continued to spread from ward to ward in the Moncton Hospital? What has happened to their infectious disease control processes, Madam Speaker? If it's not ventilation, spread by ventilation, as Dr. Dornan and Dr. Dow have said, all right, what's gone wrong there? What is going wrong there, Madam Speaker? That's the kind of thing that people need to know. You know, when this all started in March of 2020, the pandemic plan that the province had was wholly inadequate. Quickly realized it was wholly inadequate. How did that happen? How did we have a pandemic plan that was planned, that was not well thought out, that was not up to the job, Madam Speaker? How do we make sure that the pandemic plan for the future is going to serve us well? Those are the kinds of, some of the many questions we need to have answered, Madam Speaker. The capacity of public health. Has it been adequate to cope with the pandemic, Madam Speaker? That's a big question. Both its budget and its staff and the expertise of its staff. You know, there are seven medical officers of health, 7 physicians with a specialty in public health led by Dr. Russell, a great team of epidemiologists. But does that cover what they need? They don't have a behavioral medicine specialist, which to me they certainly could have used over this last 20 months to advise them on how best to communicate with the public.
You read that article too, didn't you?
How best to get New Brunswickers to understand and comply with both public health measures, so they made sense, and to put up the red flag when measures were made that were not logical to people, and they were bound to then be ignored. But also how best to ensure that people were getting vaccinated rapidly and getting their kids vaccinated rapidly, Mr. Speaker. So there is no such person in public health, but it sure would be good if there was, Madam Speaker. So looking at the capacity of public health to handle a pandemic of this scale. And what happened in special care homes, Mr. Speaker? You know, in special care homes early on, we had outbreaks. And we haven't seen anything really reviewing that and say, well, what went wrong, what went right to deal with those outbreaks, and then importantly, were those lessons transferred to the nursing home sector? were they transferred to the nursing home sector, Mr. Speaker? Because you know, nursing homes were well protected through much of the pandemic until lately. And then more recently, we've seen outbreaks in nursing homes. Why is that, Mr. Speaker? That's something that such an inquiry would help us understand. How did that happen? Was it nursing homes didn't have sufficient staff? The nurses' union back in October of last year called for an inquiry into long-term care. They were shocked and appalled to find out that there were cases in long-term care homes where we had one registered nurse for 200 residents, another long-term care home where the registered nurse had been absent for an entire month, no registered nurse for an entire month. The number of licensed practical nurses in long-term care homes have been reduced, Madam Speaker. Much more of the staff are personal care workers who don't have training automatically in their training as registered nurses or licensed practical nurses in infection control, Mr. Speaker. So how did that play into what's been happening in nursing homes? So those are some of the important questions that need to be asked in an inquiry. And as was pointed out, Ontario and Quebec both conducted inquiries into specifically their long-term care sector because of the disasters that occurred in both of those provinces in the long-term care sector early on. In Ontario, it was a commission of inquiry that the government had the courage to set up in the summer of 2020. It was, a handful of months after the pandemic began. And they had commissioners, a physician, they had a chief justice or associate chief justice, and they did a thorough job looking at the state of long-term care before COVID, the deficiencies in their pandemic preparedness, as I was saying in Ontario in that case. Best practices and promising ideas could be adopted to improve long-term care and made recommendations to government. And in Quebec, it was a different approach that the Ombudsman Marie Ganfret, she launched an special investigation into how government handled the COVID crisis in the residential long-term care sectors, and produced a report with serious recommendations on that. There's nothing negative that reflects on a government who decides to makes the right decision to launch an inquiry and an investigation into the handling of the pandemic. This is uncharted territory, and we had to navigate we had to navigate the pandemic for so many months without life-saving vaccines, which we've got now. Life-saving vaccines which have saved immeasurable numbers of lives, but before we had them, we had to navigate without them and use only public health measures. So one of the things that an inquiry would look at is the balance between public health measures and vaccination. So I think there's pretty well consensus among public health experts, infectious disease experts, that in a pandemic, you can't count on vaccines alone. You've got to maintain appropriate public health measures complementary to continuing to raise your vaccine levels to extremely high levels, which is what's necessary, Mr. Speaker. That's another question that we would look at, that should be looked at in an inquiry. What's happening in schools, Mr. Speaker? The large proportion of cases in schools now are in the elementary schools, children of elementary age. Why is that, Mr. Speaker? Well, you could say simplistically it's because they're mostly not vaccinated. But what about the public health measures that are in place? Are they difficult to implement? Are they appropriate, comprehensive enough? All of those kinds of questions would need to be looked at, Madam Speaker, to understand and learn lessons from the schools for the future. And that needs to be part of an investigation. You look at other institutions where lots of people live in a congregate setting, like homeless shelters or provincial jails or transition houses, and say, well, how do we ensure that people are protected in those situations and the virus doesn't rip through those as it has in some cases. We have an outbreak right now in our new, not just homeless shelter, but homeless housing center at City Motel, and they had to shut down, not be able to take any more people in. At this time of year, that's terrible, terrible. So, Mr. Speaker, I support this motion because it's just common sense. Just common sense. You know, the pandemic plan that was in place when COVID hit didn't really contemplate anything but the health, the regional health authorities and their needs. It didn't think that initially. It didn't consider long-term care homes or pharmacies or all kinds of things. Very inadequate. So we need to make sure that the plan for the next pandemic is robust and effective. Here, folks in government say, well, we're applying the learnings from what happened, say, special care homes a year ago to what we do. Well, okay, if that's the case, then how did we have these problems, and serious ones, with a number of deaths in nursing homes pop up this fall? Those questions need to be answered. So there are 2 more deaths today, Mr. Speaker, and we've got 136 deaths. Most of those people are faceless to us. A few we know of, and certainly, I think, as a Legislative Assembly, we should be offering our condolences to all those families who have lost people to COVID. The deaths announced today, those people were in their 50s. They're in their 50s, Mr. Speaker. You know, almost half the people who are being hospitalized are under 60 now, Mr. Speaker. So, an inquiry or investigation could be done in so many ways. The new Ombudsman could undertake it. Could be a commission of inquiry. Those are 2. A legislative committee of this House could be set up, a special committee to lead an inquiry or an investigation. It's not to serve political purposes, Mr. Speaker, but it's what New Brunswickers deserve. It's what New Brunswickers deserve. You know, the pandemic is based on a virus that we had no experience with before, none. You know, with H1N1 at least, it was similar to other viruses, and there was immediately a vaccine available. I remember running around trying to make sure I could get my kids vaccinated as quickly as possible, and it was so busy it was hard to get a clinic that you could get into. So it took a number of days. And I ended up on Deer Island with my daughters to get vaccinated when we lived in Charlotte County. So this has been totally different. A novel virus that keeps mutating, Mr. Speaker, and there's a lot of fear out there. So the other final thing that the inquiry needs to look at is communications. And how could communications be done effectively, Mr. Speaker, to minimize the fear and increase the confidence of the people of this province in what they're being asked to do, in what's going on, and frankly, Mr. Speaker, we need to see an end to the spin. We need to see an end to a spin on the communications around the current outbreaks and the pandemic in general. Thank you, Mr. Speaker.